Okay. Welcome, welcome. Look at this. We're week 8. This is officially the middle of the 16-week course. And you all are learning so much. You really are. You're just absorbing and using that medical dictionary. Don't forget the medical dictionary because this is a lot of words. Okay. All right. So this week we're going to talk about the respiratory system. So take a deep breath. All right. So the respiratory system starts at your nose and goes all the way down to your diaphragm, which is located below your lungs. Okay. And it includes everything: your nose, your sinuses, your the oral cavity, because some people breathe through your mouth, and when you have a cold it's certainly very helpful to breathe through your mouth. And then all the way down your pharynx, past the epiglottis that sits on the top of your trachea. Okay. And remember, the epiglottis is this little flap that sits on the top of the trachea, so that when you're drinking or eating, the epiglottis is supposed to block your trachea so the food and the drink does not go into your lungs. Okay. It goes down your esophagus into your stomach, right? But then when you're breathing, the epiglottis opens up so the air can go into your trachea. So every time you miss swallow, you know how and then you cough, you should say, bad epiglottis, you didn't block the liquid going down my trachea. Instead, you let it go, and now I have soda in my lungs. So that's why you cough, to expel that, right? Okay. Now the trachea, as you know, leads into the bronchi, which is like an upside down tree. If you look at it, it's like an upside down tree. So you have the trachea is the trunk of the tree, and then it branches out into the bronchi, which is plural for bronchus. Bronchus right, bronchus left, bronchi plural. And then you have your little bronchiolets. That's not what they're called. That's not what they're called, but that's how it stretches out to share the oxygen in the lungs. And then at the bottom, that's where your veins come and exchange the deoxygenated blood. Well, it doesn't share the blood. It shares the expulsion of all the trash that the veins pick up. Okay. And it takes on the oxygen, and then it goes to the heart to start all over again. Okay. Isn't it amazing how the different body systems work together to make this all happening? Okay. All right, so let's look at some specifics now. So we start in, and generally speaking, we talk about the respiratory system in two parts: the upper respiratory system and then the lower respiratory system. And you probably heard this without even knowing it, when you know that somebody has an upper respiratory infection. That's like a sinus infection or a sore throat that's clogging everything up. So you can see that the upper respiratory system includes your nose, the nasal cavity, which is the part right behind your nose that's supposed to be a big empty area until you have a cold and it fills up with mucus. Okay. And then your nasal conchae, your paranasal sinuses. Remember, sinuses are, again, they're cavities, they're open spaces. But if you have a sinus infection, have you ever had a sinus infection? Oh my gosh, that headache. The one and only time my entire life I left work to go home in the middle of the day sick is because I had a sinus infection. It's so horrible. And then you have your ethmoid sinuses that are here, if you wear glasses, right where your nose supports are, okay? And then, of course, you have your turbinate and the bone that's here, which is really not bone, it's cartilage, which is why it's hard. But when you get a broken nose, ow, that hurts, okay? Then you have your nasopharynx, which is the back part. And if you have postnasal drip, you know exactly where your nasopharynx is, because that's exactly, the pharynx is kind of like the back hallway behind your head, right? So you have air coming in the nose, food and drink coming in the mouth, and air coming in the mouth, okay? And then the back hallway is the pharynx. So with the top part of the pharynx, that is the back of the nose, is the nasopharynx, right? You know this, you're learning this. Naso, nose, pharynx, pharynx, okay? And then you have the oropharynx, which is the back part of your mouth. Oral, pharynx. That's the part where you can see your uvula and your tonsils and adenoids if you open up your mouth large enough. Okay, never mind. Ask your dentist. Okay, so that's all right here, and then the pharynx. Okay, so all that is the upper respiratory system. So infection anywhere within this section is an upper respiratory infection. You see how that works? Lots of places for mucus and disgusting things to hide. Ew. Okay, and like I said, if you have postnasal drip, that's exactly what it is. It's mucus from your nose connecting with the nasopharynx in the back hallway, headed down into your lungs or into your stomach if it goes down the esophagus. It all depends on if the epiglottis is paying attention. Okay? All right. So here now we have the lower respiratory system. And that starts with your larynx, also known as your voice box. Okay. The trachea, which goes right down in the middle. We just talked about the trachea. That's the trunk of your tree. Okay. And remember, at the top most part of your trachea is the epiglottis, and the bottom of the trachea is where it branches out into the bronchi, okay? And then into the lungs. The bronchioles are what the little florets, you know, like when you look at broccoli, right? You have the stem of the broccoli, and then you have those little florets. That's the part that you dip in ranch dressing. Very delicious and nutritious. But don't do that with your bronchi, because unless you're, you know, a cannibal. And okay, we're not going to talk about that. All right. And then the alveoli, which are the teeny tiniest of the little sacs that hold on to oxygen and exchange it for the deoxygenation from the veins, from the pulmonary veins. Okay. And if you know anybody that has asthma, it's all the way down in the alveoli that usually then start clenching. Not good. Okay. So, and you can see in this illustration, you have the thyroid gland that's up here, and then the thymus, which I know you've heard of, is nestled right there at the trachea, as it is entering the lungs, but it's not part of this system. Okay. So let's talk about respiratory diagnoses, because these are terms that you actually might be familiar with, especially if you live in the north or even South Carolina. You know, everybody gets colds no matter where you live. Okay, so the epiglottis we talked about. excuse me, we talked about this. This is that little flap, and you have learned since week 1 that the suffix itis, I-T-I-S, at the end of a word means inflammation. So if the diagnosis is epiglottitis, you know that the epiglottis is infected. The same thing with laryngitis, which you may have heard, the inflammation of the larynx. And because you know the larynx is a voice box, if that's infected, it means it's not working to full capacity. And that's why people have a hoarse voice. Not horse, H-O-R-S-E. This is H-O-A-R-S-E, because the English language has to have words that sound alike and are spelled differently. And then there are words that sound alike and mean the different thing. I don't know. I had nothing to do with this. Okay, laryngotracheitis. That's a whole mess of inflammation in here. The larynx, your voice box, the trachea leading to your lungs, and the subglottic area. Ooh. Okay, go see an ENT. Remember, ENT, ears, nose, throat. Okay. All right. Also known as an otorhinolaryngologist. Okay. So evidently Spectrum gets tired of me talking and it stops things in the middle. Hopefully the recording keeps going and you can hear about the rest of the terms that I want you to become familiar with. Okay, nasopharyngitis, the nose and the throat has an inflammation. Pharyngitis. Now remember, laryngitis is the voice box. Pharyngitis is the inflammation of the pharynx. Also often accompanied by inflammation of the uvula. You know, that's that hangy thing in the back. Okay, and then their tonsils. And then rhinitis is inflammation of the nasal mucosa. Okay. All right, congenital anomalies. This means these are problems with the respiratory system that are common with infants, neonates, infants, and young children. And as you can see, within the first 2 years, okay? And they can be anomalies of the lungs. In other words, you know, the lungs did not develop as they were supposed to. All right. Now, this is most common with neonates, especially babies that are born prematurely, because the lungs are the last body system to be formed in utero. So that's why you find respiratory distress and cyanosis as problems with premature babies, especially respiratory distress syndrome. The most common congenital respiratory disorder for full gestational babies is pulmonary hypoplasia, which is a situation where the lung does not form completely or forms improperly. And remember that in utero, okay, so you mix up the cake and the bladder, the batter, and you put it in a pan and you put it in the oven, and sometimes you take it out of the oven too soon, premature. Okay, sometimes you let it stay the whole time, but when you take it out, it's lopsided, or something is not the way you pictured it, or the way it's pictured in the recipe book. Okay, and that would be a congenital anomaly. So when you can think of it that way, sometimes that helps you remember what that means. Okay. Okay, glad you're back, Myra. Oh, our little Zoom doesn't sometimes like to know all of the details of the human body. I don't know what it is. Okay. Now, manifestations of other diseases, and this means that something with the respiratory system can actually be caused by another diagnosis. Something else is wrong. Okay. So, and I'll give you this really wacko analogy is, so you stub your toe really hard, okay? And for a while you walk funny because your foot hurts, right? Well, then the fact that you're walking off kilter can actually affect your spine all the way up to your neck, okay? So you can actually get stress and pain in your shoulders and your neck because you stubbed your toe. That would be a manifestation, something that was created in your body wrong, that is because you have something else wrong. And if you didn't have that first thing, you wouldn't have the second thing. Okay. So measles, as well as adenovirus, can cause obliterative bronchiolitis. So that is an infection in the bronchi that actually can cause a reduction in the ability to take in oxygen. And that's a side effect, if you will, a manifestation of having the measles. If you didn't have the measles, you wouldn't have the bronchiolitis. You see what I'm saying? Okay. Left-sided heart failure. So left-sided, remember, it's always the patient. So left-sided heart failure can cause pulmonary edema, which is an accumulation, edema, remember, an accumulation of fluid. You might find sometimes if your fingers or your legs get swollen, that's edema. It's not actually enlarged, it's filling with and holding on to fluid, okay? But when it's inside the lungs, that can interfere, pulmonary lungs, that can interfere with your ability to breathe and breathe in oxygen and out the bad stuff, okay? And that's a result, a manifestation of having left-sided heart failure, okay? This is when the patient might be given diuretics to get rid of that excess fluid, okay? You know, you may have had that if you eat too much salt and all of a sudden you get a little puffy, okay? That's because salt causes you to hold on to and accumulate fluid, all right? And your body is not disposing of it as quickly or as completely as it needs to. All right, and pleurisy is an inflammation of the parietal and visceral pleurae. Remember, when you're reading about the lungs, the pleura is the lining between the lungs and your chest cavity, your torso, okay? Because you need that lining, and it's got fluid because it has to be able to allow your lungs to move, right? You can't get stuck against the torso. But then that can cause pneumonia, lupus erythematosus, pulmonary infarction, trauma to the chest, tuberculosis, and other things. I had a friend a long time ago who had pleurisy, and he passed away, much too young, of course. But the point is that it's important for you to get a sense of, again, how one thing can affect another thing in your body and in the patient's body, okay? So just because the patient has measles, if the patient then develops obliterative bronchiolitis, we know these two things are connected, which is why children should get the measles vaccine. I'm not getting into politics, but okay. Lifestyle behaviors. Oh, I don't need to tell you smoking cigarettes and cigars and and what's that called? Uh Vaping. Vaping actually has been known to cause more respiratory disorders almost than cigarettes or cigars, including lung cancer. And there's even a very specific diagnosis of vaping respiratory disorder. Okay, so it sounds good because it doesn't have the stuff that cigarettes and cigars have, but so it has other stuff that's no good for you. So wait until you're 96 years old, and then if you want to start vaping, you have my permission, okay? That is if you don't want to live to be 100. Okay. Sedentary lifestyles can encourage the creation of thrombi in the legs. Now remember, thrombi is plural of thrombus. A thrombus is an embolism, which in regular speak is a blood clot. Okay, so an embolism is a blood clot within a vein or an artery that's just tooling along throughout your whole body. Bad. Because you know what? Then it gets somewhere like the valve in your heart or somewhere else. And if it gets stuck, oh, deep trouble, especially if it gets stuck in your brain. That becomes a stroke, a cerebrovascular accident, which shouldn't have happened. Okay, so the embolus, sometimes the embolus attaches to the wall of the vein or the artery, and then it changes its name as it puts up residency inside the veins and the arteries, and then it becomes the thrombus. A thrombus is an embolus that has attached to the wall. Now, sometimes, maybe more often, a thrombus creates, so it kind of develops on against the wall of a vein or an artery, right? But then it breaks free and it changes its name to an embolus, because then it's free to travel through the arteries and the veins. And like I said, it can be stuck in your lungs. That's a pulmonary embolus. That is a very painful way to die. Again, it's blocking the opportunity for that exchange of oxygen and waste matter, CO2. Okay. Trauma is another well-known cause of problems in the respiratory system, especially if you're driving, because that airbag is going to hit you right here, okay, or right here, depending upon how short or tall you are, all right? Plus, you are wearing your seatbelt, so of course you're not going to hit the dashboard, but it can result in trauma to the nose, okay, the nose, the chest, the throat, okay, which can interfere with the patient's ability to breathe. You already know that, especially if you watch like Chicago Med or Chicago Fire or 911. That's another one that's really good about learning about all of this stuff. And if you do watch those shows, then I want you to pick out the medical terms or replace the words that they use, the regular words, with the medical term. It's a good way to practice. Okay. Traumatic pneumothorax. So let's take that apart, because you learned this. Pneumo means oxygen, air, because that's pneumo as in pneumonia. Okay. Thorax is in the chest. What happens is that air can get stuck between the lining of between the lungs and the torso, your chest wall. Okay. So what happens if air gets stuck in there? your lungs cannot expand, which means you cannot inhale, which means you cannot bring in oxygen. Oh, we got a problem. That's when you see on the TV shows and they take like a pen and they stick it in the patient's chest and then the air escapes and then the lungs can fill fully. Okay. It also can result from a penetrating chest wound. Again, like a bullet. We don't want that. Too much of that. I don't even have to go to the TV for that. It's too much in the news already. I'm tired of people getting shot. Stop it. Okay, so a medical misadventure. Okay, that would be that's what they call a medical error. Okay, a medical misadventure. Isn't that sweet? Okay. All right. So pneumothorax, you also might, hopefully from just watching television, hear about a hemothorax. Hemo, blood, thorax, chest wall. So now instead of oxygen preventing that expansion of the lungs, the chest cavity has filled with blood, hema, blood. And the same thing is they have to do an incision to remove the blood so the lungs can expand again. Okay. Do not try this at home. Just know and understand it. Okay. All right. And of course, just existing on planet Earth can cause respiratory problems. Oh, did you see that video that was on YouTube? The volcano that was erupting? I don't remember where it was. Okay, thankfully not in the United States. Okay, but this volcano was it just like unbelievable. But the thing is that while you may stay out of the hot lava and the big black smoke, the fact is it's still putting little dust particles in the air, which will travel and get into your lungs. Okay. You've all heard about asbestos removal, but things like asbestos and other building materials can actually cause respiratory problems. And then we also have specific conditions such as Legionnaire's disease. I don't know if you remember that from the news many years ago at a convention center, because the aerobic means it travels through the air, right? So you also may know this from aerobic exercise, right? Which just means to generate air, oxygenation, okay, of a gram-negative bacillus, which is actually, I believe it's a form of fungus that transmits through the air, such as air conditioning systems. Not very nice, and no way to prevent it. Although that could be one good side of COVID, although nobody's really wearing masks anymore. But that's exactly the whole concept of wearing the mask, is so that these pathogens cannot get breathed in by you and get into your lungs and then into your bloodstream and make you sick. Bad, because we don't want you to die. Okay. All right. So what do I tell you every single week? Because this is the way to do it. You got to just review this, review it. You cannot memorize. You cannot memorize all of these words unless you are who? Sheldon from Big Bang or Spencer Reed from Criminal Minds. Can you tell I watch a lot of television? Very educational television, though. Okay. Use that medical dictionary if you come across a word that you don't know, or maybe you're not sure, or maybe I think that's what it means. Look it up. And that way you are remembering the correct, accurate description or definition. And I am here 7 days a week. So query me when necessary. Whenever you come across something you are uncertain of, you don't know, you don't understand, this doesn't make sense to me. Aha! Contact Dr. Safian email-wise right away. I promise to reply to you within 24 hours, and we'll figure it out together. Okay? 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 Yeah. Okay. Thank you very much, and have a wonderful day, and be careful what air you're breathing.